Chronic Pain Patient Support Group. My name is Terry Bremner, and I volunteer and advocate for CPAC, the Chronic Pain Association of Canada, and the millions of Canadians who suffer daily the hills, hurdles, and obstacles of living with chronic pain. A chronic pain support group, what benefits? Well, it establishes hope and encouragement through others that have walked the dark path of living with pain. There's shared experiences and treatments and symptoms that we have. We all struggle with the feeling of loss of our career, our job, financially. A chronic pain support group instills a sense of believing and belonging and even though it's not visible of our pain. We can overcome feelings of being alone, isolated, and judged by others. Self-management helps gain self-control. Groups are educational. Groups assist in developing coping strategies and skills. The emotional comfort and moral support is essential. It opens doors to awareness at community services and links, such as a multidisciplinary chronic pain clinic. It promotes socialization, and new friends are gained. Meetings are confidential. You can talk openly and honestly. And tears are welcome. Understanding of a chronic pain support group, it's purely an information session. Each person's pain condition is different, but we share all the symptoms. Depression, sleep, fatigue, anxiety. The impact of chronic pain on our work relationships, the hobbies that we had, and the daily activities is immense. The need to help improve quality of life, daily functions. Coping with the consequences of chronic pain and fear the barriers and difficulties living with chronic pain has on relationships and obligations. Support group helps reduce stress, depression, anxiety. There's lots of uncertainty and we feel less capable and less confidence and have a lower self-esteem. So these can all increase by learning from a group. It's a great opportunity to educate family and gain understanding that we want to live to the fullest every day, though we have to adapt and take the advice of the new life changes. Many health professionals recognize the value of psychotherapy in a group setting. It's a privilege to be a facilitator of a chronic pain support group. That doesn't mean that we know it all and we're not the boss. We establish, organize continuity, compassion, resourcefulness. We turn negatives into positives and frowns into smiles. Pain professionals support the power of psychotherapy. The therapeutic aspect of chronic pain support group is supported by most all general practitioners in Canada. Group members express satisfaction and a positive experience from going to meetings. Tips for running a successful chronic pain support group. Location. Well, there's no money available to pay for a meeting room, so what's accessible free? Many have found different locations, possibly in Lions clubs or Chamber of Commerce, library buildings. Many major food stores now have community rooms that are available, and most are all at no cost. The location has to have access for people, whether it's a ramp or an elevator that may be required. It's a safe place. When people come into the meeting and the door's closed, we have to tell everyone this is a safe place, and what we talk about in there stays in there. The meetings are free. Many people don't have the finances to be paying to go to meetings. And the meetings are once a month. Though with our memory symptoms it's good to have the same time each month. Whether it's the last Monday of the month or the first Tuesday, members have found it beneficial to have it structured that way. We'll have a poster for our group talking about where we meet and at what time. Though, where are we going to put the poster? Starting off, we can put it into pharmacies, medical clinics, doctors' offices, physiotherapy, massage therapy, chiropractic that are in your area. The length of the meeting, most meetings last for two hours. So ensure that you leave the last 15 minutes so that the member of the groups have opportunity to meet each other and maybe talk about their shared experiences. Should it be morning or afternoon or evening? Well, in the big picture, chronic pain people not always are mobile early in the mornings. Much success has been around a 1 to 3 time or even a 7 to 9 p.m. time. The value of having a co-facilitator, someone that can share the workload, or in the event that there's a flare-up, they're able to take the meeting so that there's someone there. The meetings, we don't endorse any speaker, no products. It's solely an information session. In starting out the meetings, if we can sit in a round circle and do our introduction, and everyone has a 2-minute chance to say who they are and what struggles they have and what symptoms they may struggle with. Though it's good to make sure that you stay on track and you keep this routine into the group. Maybe a talking stick can be of great value so that other members don't interrupt while someone else is talking. It's very good to have the members be part of the group, and we can give responsibilities out to them. We can have someone as a greeter at the door with name tags or a piece of paper to get new member information so we can stay in touch. As chronic pain patients, we have a number of books on living with pain and the benefits of treatments. So if we were to all take our books and put them all together in one pile and someone had to pull a long suitcase, all of a sudden we have a library. And that library will enable people that can't afford these books to sign them out, take them home, and educate. When we have our meetings, it'd be great to have speakers come in. There's love of many industries that would love to have a captivated audience of chronic pain patients. Those presentations could be mental health or acupuncture or nutritional. There's many different aspects that can come in to educate us. Maybe it's topics for meetings. Maybe we talk about medications. Maybe we talk about constipation from the medications. We can do workshops. Workshops could be done on understanding chronic pain, the difference between acute and chronic pain. Maybe we can talk about coping strategies or the symptoms that we share, or exercise. Each group and each member of the group could also have education on goal setting. Goal setting is very important to try to do it for one day or 1 week or 1 month. Goal setting is very important. To do a workshop on goal setting and being able to talk about it being achievable or believable goals, conceivable. Do we want them? Are they desirable? And are we hoping to accomplish this goal by the end of the month? I hope that you enjoyed this presentation. I hope that you share it with others. The drug, that feeling that you get from being a facilitator of the self-fulfillment that you do for others and helping is overwhelming. If it's to be, it's up to me. Thank you.